Welcome back, guys. Welcome back on Healthcare One-on-One. You're here with your all-time favorite host, Julian Brown, and like always, I'm just being modest. We're here on our Q&A session, and our next participant is Cindy. Cindy from Ohio. Hello, Cindy. Let's see what you've got on your mind. Cindy has been writing to me about this essay she's supposed to submit on Monday about the pathology of the urinary system. And I have to ask you this, Mrs. Gupta. Do you think you can help us? Julian, I'm out to tell you that neurology and urology don't necessarily go hand in hand. I will try my best to respond to any questions Cindy may have. I'm so glad you take the challenge. Where Cindy wants to know about this illness called incontinence. So, what can you tell us about it? Urinary incontinence is the involuntarily loss of urine, a condition when a person cannot control when they urinate. It can range from occasionally leaking urine when you cough or sneeze to actually having this sudden strong urge to urinate and not being able to make it to the toilet on time. Trying to link this urinary problem to the field of neurology, I suppose this is something you see quite often in the patients you work with. Can urinary incontinence signal damage somewhere in the nervous system? What do you think about this? It's true that certain types of incontinence, such as urge incontinence or reflex incontinence, can be linked to neurological conditions such as Parkinson's disease or Alzheimer's disease, or they can occur in patients that suffered from strokes or brain cancer. But it's not always the case, it really depends on the type of incontinence you're talking about. Mhm. That's very interesting right here because you said it depends on the type of incontinence. So that means there are several types of incontinence. It's like a classification, maybe, no, isn't it? Oh, yes, there are several types of incontinence. For example, there is stress incontinence when leakage occurs during certain activities such as coughing or laughing or sneezing. There's also urge incontinence and also called overactive bladder when there is a sudden urge to urinate. There is also overflow incontinence when the bladder cannot empty completely. There is also functional incontinence when sort of impairments, physical or mental impairments, prevent the patient from going to the bathroom. And there is also mixed incontinence, which is a combination of stress and urge incontinence. So, yeah, there are several. I see. Well, this makes sense. But if you say that not all types of incontinence are linked to damage in the nervous system, I suppose there might be other causes. So, can you tell us a few? There are several causes besides nerve damage that can cause urinary incontinence. For example, the most common causes would be a weak pelvic floor muscle, which usually occurs after pregnancy and childbirth, or even a change in hormones, which occurs during menopause, or even after repeated urinary infections, or after taking medication, or from an enlarged prostate. Yeah, this could be some causes. I understand. Well, Cindy's been asking about the Kegel exercises, and I find it fascinating. Apparently, they can curb urinary incontinence. What do you think about them? What can you tell us? Well, yes, the Kegel exercises are a type of exercises that are used in order to strengthen the pelvic floor muscle. You may do it by tightening your pelvic floor muscle for 3 to 5 seconds, then release the tension for 3 to 5 seconds, and so on. Repeat it, let's say 10 or 15 times. But the Kegel exercises aren't only good for urinary incontinence problems, they can also be used to prevent pelvic organ prolapse, such as uterine prolapse, or they're even said to help with the sexual function. Well, now it's more of a personal curiosity that I have. If I recall well, you said that one of the main causes for urinary incontinence is the enlargement of the prostate, and thinking how common prostatadenoma is among the male population, like 1 in 2 men will develop prostatadenoma by the age of 60. I'm out to ask, are there any any correlation between the two? I'm asking for a friend, really. Yes, Julian, I understand your concern, and yes, it's true that prostatadenoma is correlated to urinary incontinence because, well, you see, when the prostate grows in size, it can compress the urethra, making it harder for urine to flow, and because of that, the bladder can't properly empty itself, which leads to overflow incontinence, unfortunately. Also, it may be that because of the blockage of the urethra, that causes the muscle of the bladder to become overly stimulated, and this may lead to urge incontinence. But also the hope is not lost because it is reversible with treatment with beta blockers. But also, it doesn't happen to everyone. It's mostly in advanced cases of adenoma. So it doesn't really happen to everyone. Well, if you ask me, it's still pretty rough out there. But thanks a lot for your insightful presentation, Mrs. Gupta. I know I learned a lot. I'm sure our viewers learned a lot as well. Now we're supposed to carry on with Cindy's questions, but before that I will have to pass the mic to my co-host Danielle. Let's see what he wants. Hello, Danielle.